Hi, on this episode of Plastic Surgery Uncensored, we're going to be taking a closer look into what is the specifics of identifying a diastasis rectus expert. How do you know who is and who isn't? And you definitely want to tune in because this information is going to be really, really important. Welcome to another segment of Plastic Surgery Uncensored. This is your host, Roddy Raban, Dr. Raban, and I'm here today with a dear friend and an amazing DR advocate and patient of mine, Renee. And what we're going to be doing on this segment is, this is a 4-part series. I think DR or diastasis rectus information is crucial, and I think the good information is missing from the content that's out there. So we put together this 4-part series, so to speak, regarding diastasis. And this one is going to be about, now that you've identified that you have diastasis and you've identified, well, okay, now I can't fix it without surgery. The next question is, well, how the hell do I find myself someone to fix it? And what does it mean that someone's an expert or non-expert? Isn't it just a tummy tuck? Can I just go get a tummy tuck from the guy down the street? And so we're going to dive into the specifics. I will, as I always do, just quickly define what diastasis means in case you didn't listen to the previous 2 episodes. Essentially, diastasis is the separation of your abdominal muscles, so-called six-pack, as a result of having children or the pressure inside your abdomen and when you expand. And every time you have a child, that separation will get slightly greater and larger, and as a result will lead to bulging of your abdomen, in some instances severe back pain, constipation, bladder incontinence, etc. And truthfully, the only way to fix it is to bring that muscle back together. And from the other segments, which I hope you listen to, you'll realize that, this is not a hernia. It should be done in a very sophisticated manner. There is a expertise associated with doing this. And again, this is not your garden variety routine abdominoplasty or tummy tuck. So we're going to dive in here. I am joined here by Renee Dallas. And Renee is what I refer to as the quintessential poster child for severe DR. In that, she is, of course, an amazing mom of 3 children, but presented to me, what now, is it 18 months you said, Renee?
Yeah, it's been about
18 months ago, 18 months ago with a severe case of DR, and now she's #1 in our gallery. #1, which means she looks so amazing that not only is she excited, but we're excited, and we want her to represent what it takes and what you can and what you hope to accomplish as a result of undergoing a correction. What we're going to do is we're going to use Renee's story to help guide you so that you don't have to go through necessarily as many steps or make the journey a little bit more direct as Renee, because Renee spent many months trying to navigate this process as she determined that she had DR, and then subsequently who the hell was going to fix it. So Renee, let's start. When did your DR, so tell me a little about, you were going to be a figure skater, so everyone know that you were super fit. So tell me a little about your story.
So yeah, as you mentioned, I was always very active, grew up with 2 older brothers, so that says anything. I have 3 kids, and I make them large. So I have large babies, healthy, thank God. But it definitely did a number on my body. So after #2, it was recognized that I essentially had stretched beyond capacity, and I was obviously very tiny before. So, and I actually kind of am now, thank you to you. But anyway, after the 3rd, it got even worse. But it was worse in the sense that I was just more symptomatic. So then some of the things that you had mentioned, like the back pain, essentially, mostly it was the back pain, just no function in the core. It was like loosey-goosey everywhere.
So your abdomen had become, as a result of your 2nd and then subsequently your 3rd, your abdomen had stretched and stretched. If you were to go look at her results, her photos, she had a huge protuberance of her abdomen, and she needed binders, 2 girdles, just to get up and take care of her kids and do her daily activities. Otherwise, you couldn't function, right?
Right. Yeah. So, with the DR, when I had it, that's exactly what I had to do. I had to have like a girdle that I had to basically like button up, 50 buttons so that I could just push everything back into my body because it was like coming out. And then on top of that, because of the back pain, I actually wore a brace. And I also am very active with my kids. I'm always lifting them. I'm running, jumping, hopping, whatever. So in order for me to be very engaged with them, I had to do what I need to do. And that was the only way I could get enough support to compensate for the lack of support.
Right. So here you are. And what I want you to do is, as a result of your journey, we're going to go step by step, because basically what's going to happen is your journey is going to be the same as everybody else's. Everybody who has a severe diastasis, again, by severe, I mean to the point that you're unable to function. Anybody who has severe diastasis is going to feel and experience almost the same thing as you did, and everybody does. And so you went through this very arduous journey. My understanding is you saw 11 surgeons prior to seeing me, and I know you very well. You're very bright, you're very reasonable, you're not some psychotic, crazy woman. And so you obviously had to go through this really long journey, and as you're going to describe, because things were not adding up. And what we want to do is we want to help people so they can navigate this process quicker, so they can just say, oh, I have this DR. Oh, I need it fixed. Oh, let me find a DR expert. So you had this huge protuberant belly, and who was the first person to tell you, like, you're like, holy crap, this is crazy? And so you went to what? And who told you what?
So initially my OB said that I have it. And then I basically graduated from that arena and I went to a physical therapist.
So wait, he said you had what? He said, oh my God, look at your belly. You're like, I don't understand. My belly is just so protuberant. And he said, you have DR. Then you had told me that you started Googling DR, right?
Exactly.
And so you Googled DR and you said, oh, how to fix DR.
Yes.
Right. And then so in addition to going to a physical therapist, which we've discussed on the other episodes, is great. It's wonderful. It's going to help your core a little bit. But what happened after you had physical therapy? Nothing.
Exactly.
Your abdomen did not flatten. Your DR did not go away. Your symptoms did not resolve. So you realized that you needed surgically fixed. So what did you do then?
So then I went to my primary care doctor, who recommended me to a general surgeon, who then wanted a CT scan just to make sure that that was legitimately what was going on, because it was such a severe case. And
so
he also died.
You went to your primary care. You said, oh my God, I talked to my OB. He says I got some DR something or another. I Googled it. Looks terrible. And what should I do? And your primary doctor said, you know what? You should go see a general surgeon, because of course you got this huge thing wrong with your abdomen. And then you go to your general surgeon, they look at you and they're like, whoa, okay. I think you need a CAT scan. Something doesn't look right, which is just underlying, like already right there. Like what could your belly have looked like that needed that? But when you look at your photos, you'll understand.
Yeah.
And then you came back and the general surgeon said what? So
then he said, you have diastasis recti, you have potentially like a hernia, small hernia as well. And he said, I honestly can't help you. You need more than just what I can do. And you would need, and he highly recommended that I go see a plastic surgeon.
Great.
And that's what I started.
So basically what you lucky is that your general surgeon had the wherewithal and the presence of mind as your physical therapist to know that they were not the right people to fix the problem. So when it comes to DR, it should be, in my opinion, fixed by a plastic surgeon, because almost always, not always, but almost always, it's accompanied by some loose skin, some stretch marks, some other issues. And it isn't something, in my opinion, that a severe DR can ever be fixed by doing some Mickey Mouse procedure done by robotic or endoscopic. If you have severe diastasis, it needs to be corrected by a plastic surgeon who knows severe DR, so that you can have not an okay outcome, not a so-so outcome, but like a wow, amazing, functional, and beautiful outcome. So he was smart enough to tell you to go see a plastic surgeon. So now you're all excited. You're like, oh, okay, I'm gonna go see a plastic surgeon. You live in Dallas. So I'm assuming you went and saw people locally, correct?
Yes, I started here in the area.
Who did you go see and what did they tell you?
Okay, so I obviously tried to research the top surgeons in the area. I went to my first consult. And I was all excited, thinking that this is going to be, amazing and whatnot. Okay, so it was eye-opening in the sense that he had said that basically go get, whatever you have going on here, go get that fixed and come back to me for a tummy tuck because you're going to need it because you have the extra skin and so on and so forth.
So basically you went and saw a top reputable surgeon in Dallas because you're a researcher. And when you went and saw this individual, his comment to you was, go fix your abdomen and then come back for a tummy tuck. So why that is important is I want to underscore to you why severe diastasis is an entity of its own. Obviously, the surgeon, if he's very reputable and skilled, he does tummy tucks, right? And in tummy tucks, we always fix some degree of diastasis. So, but for him to tell you to go elsewhere already automatically tells you that he doesn't want to deal with it because it's too severe and that it's not something that just even a reputable guy is just going to tackle on.
Exactly.
So that led you to realize you were bummed out because you're like, oh, wow, I was hoping this is going to be one and done. And then, so then where did you go next?
So then I recomposed and did more research and found another supposedly, top surgeon.
Okay.
And so I'm like all hopeful, all excited. Okay, this could be the one. And then I came in, and one of the things that he recommended, he's like, you have a very severe case. Your tissue is just completely destroyed, very thin, not essentially your muscles are like, I could flex one and not the other. Like it was just a mess. And he said, the only thing that I would recommend is mesh. And
done.
Yeah. No mesh. Yes.
And you knew right there that mesh, you knew, but most patients don't, that mesh is not something to be considered lightly.
Right.
Why? Because mesh is a foreign material, and when a foreign material enters your abdominal space, it can and often does cause a lot of inflammation and other issues that come along with it. So when you consider mesh, you got to be damn well sure you need it. And so the reason why he mentioned that to you was because when you have severe diastasis, essentially what's happening is that the muscles which are connected together start to slowly and gradually pull apart, and they do not create a hole. They start to pull apart, and then the connection is this very thin film that gets pulled apart that still creates a barrier, but that barrier is very flimsy, such that when you do a straight leg raise or when you bend down, you can see the bulging come out. And when you put your fingers inside your abdomen, you can feel the edges. So what he was referring to is, in your case and many other severe cases, is your own tissue had thinned out or been pulled apart so much that it didn't look very robust. And his concern was that when you corrected it, it would not hold together. Imagine sewing cotton candy to string cheese, that nothing would hold. And therefore he thought, and he suggested mesh, which, as you know, from my perspective, I am 100% vehemently opposed to. I have never, nor did I in you, ever use mesh to repair even the severest cases of DR, because in diastasis, there is no tissue missing. It is pulled apart, it is thin, it is frail, it is crappy, but it is all there. Whereas in a hernia, an actual hernia, which is a physical hole, there's a hole in your belly, there's a hole and there's stuff missing. And in those instances, it may or may not be necessary, not my area to discuss because they're a hernia expert, but this is its own animal. So you said, oh no, I'm not using mesh. I've read all kinds of negative reviews on mesh.
Right.
Thank you so much. Next.
Yeah, basically, thank you, but no,
what happened then?
So then I went to, the next research surgeon. And mind you, I like looked through hundreds of galleries. I mean, I was picking out what was the top of the top here in the city. And okay, so then I came in, he's like, wow, I wasn't quite expecting that. And then the one thing that stopped me there was that he said, okay, we can correct the DR without mesh. I said, okay, that's one step better. Now, but you're going to walk out with like a flat, like a blank piece of paper stomach, like your belly button will probably not survive and you just won't have one. And is that okay by you? And I'm thinking like, let me think about that.
So let me get this straight. what you've experienced and the reason why you went through potentially 11 consults is not because you're some psycho. It's because in every instance, you went there and there was some major compromise that was being suggested that you weren't comfortable with.
Exactly.
And so what happens is that people with severe DR, it's a functional issue. It's like having gallstones. It's like having fibroids. It's a problem. You can't exercise, you can't function, you have back pain, etc. But you also have a cosmetic issue. And so what happens is that you get suggestive or desperate that in order to get my functional life back, I must be willing to compromise on my cosmesis. I have to be willing to give up something in order to be functional. And I have said to you, and I say all the time, you should demand both outstanding functionality in conjunction with great cosmesis. You should not be like, well, I got no belly button, so it's good enough. So what you're telling me is that this particular surgeon said, I can do it without mesh. Awesome. However, you're unlikely to have any belly button. Are you okay with that? And clearly, you weren't okay with that. Exactly. So then yet another, and you go on. And again, mind you, all these people, you don't live in Two-Bunk, Mississippi, or some tiny little hole in the wall place somewhere in the middle of the country. You live in Dallas, which is arguably the top 4 cities in this country with some of the most trained and reputable plastic surgeons. And thus far, by Googling the hell out of it, these are the top people you've seen, and these were their responses.
Right.
So where did you go next?
Okay, moving along to the next surgeon. I mean, I thought I was stopping at 3, but that wasn't the case. I think in general, after that, it was either some combination or some form of either recommending mesh, or again, the belly button wouldn't survive, or just in general, there was almost like a fear of what they would do. And I felt like I didn't walk away feeling confident that, and it's not that I wouldn't give someone who's an excellent surgeon even a chance. Like, I actually may potentially do that if they are a very skilled surgeon. But the thing is that I didn't feel confident with anybody from that point on, because they weren't sure how they were going to fix it. And I can't walk out thinking like, well, if you're unsure, then I'm really unsure.
So what you're saying is that there's nothing worse as a patient. You're almost willing to make the leap of faith with your surgeon, so long as your surgeons demonstrate some degree of confidence. And when a surgeon makes you feel as though they're not sure, it's a very off-putting and very unnerving situation.
Right.
So you ultimately decided to come to LA, which is what often happens is if you're not satisfied with people in your local area, you really should look outside your area. I'm not suggesting LA by any means, anywhere where you find someone that serves what you're looking for, because this is your body, this isn't a used car, and so on and so forth. What was it in particular that led you to come all the way to me, for example? So what I'm trying to do is teach the average person the elements of discerning between what we're talking about in this episode is how to identify a diastasis expert. Pay attention. Self-touted and self-reported experts do not count. In other words, saying you're a diastasis expert does not mean anything. What means something is you go on their gallery, and what you should see is multiple examples of severe diastasis after one another with outcomes that you consider to be outstanding. Then, and only then, are they diastasis expert. Not because they went to school or they took a program or they give a lecture or because of anything. The only thing that matters is you go on the gallery and you look at the side profile and you're like, wow, this woman looks like 4 months pregnant. Holy, wow, look how flat she is. Time and time and time again. That to me is what makes you an expert, not the words that come out of your mouth or what you have on your website. So you finally decided you came to LA. This is not about me, but rather about what were the identifying qualities that you felt made you say, oh, okay, that seems to be the case. What did you need?
So I guess starting from the basics is that I definitely wanted board certified. I guess I probably should have specified at the beginning when I was looking for all my surgeons. But the number one thing that I eliminated a lot of surgeons from the get-go was that they were all board certified, and I verified it and just made sure. That was number one. But it's you specifically, I actually, without even at first realizing it, I was actually using your examples to go, I mean, I don't know, that may not be such a great thing to do, but I was using it because I identified the things that were really important to me. So it was not only like, function was number one. That was the whole reason that brought me into fixing this, but the aesthetics were also very important. So if I would have been embarrassed to wear a bikini with my DR, I would have been equally embarrassed to wear a bikini with gnarly scars and crooked scars and everything like that.
Right. So I mean, you make a point. And we're going to get into the details of specifics like board certified, suture technique. There's going to be specifics in the second half of this episode. But what you were saying essentially is that you were gravitating towards and you were desiring, which is what is natural for the patients to have good function, but also look good. What makes you look good with an abdominoplasty is a low scar, a normal looking belly button, no dog ears, not some weird convexity or bulge. There are some basic things, a long abdomen. There are things that make people look really good. That's what we consider attractive. And just because you have a severe case of DR shouldn't mean that you should somehow just be like, those things aren't important. Yeah. So essentially what you're saying and what people listening should do is they should hold, if you have severe DR, you should expect the same things if you don't have severe DR as far as I'm concerned in terms of your cosmetic outcome. And that's really, really important. And the thing about your abdomen that was very unique is that you had super, super, super thin skin. That means your belly button was completely destroyed. You had no belly button, nothing to be seen. That's why the guy said he was going to die. Your skin was super thin to the point that when you lay down, you could see literally the movements of your intestines. It kind of looked like something from Aliens, right? You remember that. You called it your alien.
Right.
You named it.
Totally.
And so, everyone was afraid that your skin would die.
Yeah.
Because you could literally see through your abdomen.
Oh, yeah.
But all the more reason why you want someone who's going to feel comfortable in doing so. And if that means that person is out of state, out of the city, out of country, whatever, it doesn't matter. Just go find the person, because if it doesn't go well, you're going to really be bummed out. And if you think for a moment that, wow, my core is so strong, I'm awesome, but your belly is ugly and you're okay with it, you're kidding yourself. It's never going to happen. You're going to want your belly to look attractive, even if your DR is fixed and it was terrible.
Exactly.
So what we're going to do is we're going to take a break. And then what we'll do is we'll come back in the second section and we're going to dive into the specifics. Like, what are the exact specifics? What do I need to ask? What do I need to look for? How do I know? So make sure you tune into the second half of our episode on finding your DR specialist. All right, welcome back to the second half of our third episode of Plastic Surgery Uncensored. It's Dr. Rodney Raban with my dear friend and patient, Renee, and we're going to really dive in now in the second half on all the specifics on how does one identify, like they would any other expert, into someone who does DR. So first thing you need to know is there are some basics, real basics. They have nothing to do with anything. Your surgeon should be board certified. Again, let's start back up. You're going to want to go to a plastic surgeon for this. You're not going to want to go to a general surgeon. You're not going to want to go to a hernia specialist. You don't want to go to anybody else. You just want to go to a plastic surgeon. Then you're going to want to make sure your plastic surgeon is board certified in plastic surgery. Not board certified in OBGYN, but board certified in cosmetic surgery, board certified in ENT, facial plastics. All that is nonsense. There are many of my episodes that address this concept, but just make sure they're plastic surgery board certified. Then you want to make sure that they've done this. And so by going on their gallery, you can determine, make sure that you are not fooled by self-proclaimed experts. That means you go on their website and they write, I am a diastasis recti expert. I am a rhinoplasty expert. I am an eyelid expert. If you then go to their gallery, which is basically showcasing their work, and you do not see amazing result of severe diastasis, then they are not a diastasis expert, no matter what they tell you, or where they trained, or nothing. It's very simple. When you go on their gallery, you should see 5, 10, 20 cases of severe diastasis. And I'm not referring to just a regular old tummy tuck. I'm talking about, you look at their side view, and you're like, whoa, that pre-op is serious. That woman looks 5 months pregnant. What is going on with her belly? Why is that thing the way it is? those are severe cases. And Renee is number one in our gallery for a reason, because her before photo is severe. And so that's when you know that that person is an expert, not because they said so, but because they show you, right? Right, Renee? Is that so far following on point? Is that what you did to figure it out?
Totally on point. Absolutely. You're
okay. Okay, then you go and look at their reviews. And so reviews are like everything else. It's a double-edged sword. You don't want to just like take anything blindly. You're not going to go on a date with a guy and because he uses the wrong fork, decide he's not the one. But at the same time, you're going to like, wow, this guy doesn't have the best manners. So you're going to read the reviews and you're going to read them for content, not quantity, but content. So you're going to read them. And you're going to read them. Yes, the fact that the person has 200 amazing reviews about rhinoplasty is great. It means that they're a good surgeon, but doesn't mean anything about your diastasis. So you want to read about tummy tucks and diastasis, and then you want to read them. And if there's bad reviews, take them for a grain of salt, read them. If someone says, this doctor's amazing, this doctor's amazing, his work's amazing, his work's amazing, and the negative reviews are like, I waited so long, his consult fee is so expensive. Well, then that's obvious. Who cares? You're there to get some surgery done. So pay attention to the reviews. And then we're going to get into the specifics of how the hell they correct it. So I think the key to it is when you correct a diastasis, what are you doing? What's the magic? You are physically sewing the muscles back together. And in order to get access to the muscles, you need to do it through a tummy tuck. You need to open up the abdomen in order to see the muscles, in order to fix the muscles. So you can't get to a diastasis repair, in my opinion, although there are people who tout alternatives, without an abdominoplasty. They're doing robotic, endoscopic, all this other nonsense. If you have severe diastasis, listen carefully. Do not do anything Mickey Mouse. You need an abdominoplasty, and 95% of people with severe diastasis have other issues. Loose skin, stretch marks, blah, blah, blah. So you get to do a cosmetic surgery for the functional repair. You need to get in there and repair those muscles. It takes skill. People with severe diastasis do not just have this perfectly round belly. They're bulgy in weird places. They're bulges at the top and not at the bottom. They're bulges in the center and the top is flat. It's all kinds of weirdness. So if you are going to repair that, you better have a damn good skill set in putting that muscle together. It isn't like it's like an anatomy book. You see their lines on the side and you're like, oh, there's a line, just sew them back together. It does not work that way. What kind of suturing do you use? Most surgeons who repair a diastasis make a running suture, start at the top of the abdomen and run straight to the bottom with a running singular suture that's like what we refer to as a baseball stitch, because it's fast. In and out, done. The problem with that is even if you repair it, which usually you won't in a single layer, if you were to fall or cough and it were to break, that suture would completely and totally unravel because it's only one stitch all connected together. Doesn't that sound frightening or concerning? So the way I repair my diastasis and the way I believe it should be repaired is, number one, I use what's called a figure of 8 interrupted suture. So there's two words there. Interrupted means they're individual sutures, meaning from top to bottom, there's like 25, 30 individual sutures. So that takes the tension and divides it by 25. There's a concept what I refer to as Lilliputian. Lilliputian is referring to Gulliver Travels. Gulliver Travels was a story for children, and it basically meant tiny little people, Lilliputians, picked up Gulliver, who's a massive giant, because they all shared the weight and they all picked him up. So these sutures do the same thing. They just spread the tension so it's not on riding on one thing. And figure of 8 means that you're grabbing a bunch of tissue. So like in Renee's case, her tissue was garbage. It's thin and tissue was really thin and frail. The concern is that you grab it and the suture doesn't break, but the tissue gives. So figure of 8 means you're taking a good bite of 2 times of that and do it. Once you're done suturing, guess what? You need to do it again. You haven't even begun. There's so much laxity in the abdomen. And so why a diastasis correction that looks amazing is you do it in a layered fashion, layer upon layer, and sometimes even a third layer. And that's super, super important. You have to do maneuvers like putting air in the abdomen to mimic. Remember, Renee would lie down and her abdomen would be as flat as a board. Actually, it would get concave. It would go inwards. And the minute Renee would stand up, it would look like a basketball was stuck in her abdomen. So when your surgeon is operating on you, guess what? You're laying down. So you suture everything together and you're like, wow, that looks really good. You're proud of yourself. You pat yourself on the back. And then the patient shows up and they take the garments off the first week and you're like, oh shit, there's still a bulge there. It's better, but it's certainly not flat. What is this? I'm swelling. And it's incomplete because you thought you had fully corrected it and you didn't. So there are maneuvers that your surgeon can do in order to make that check inside the surgery. And so that's very, very important. Does this all ring a bell, Renee?
Absolutely.
So, I mean, Renee knows all this all too well because she did this whole process and she learned these things together. Now, so that's your diastasis repair. Sometimes you need to do oblique repairs, meaning you're not just fixing down the middle, but you need to put repair on the sides because in addition to the diastasis, your abdomen just stretched out so much that it just can't be fixed all through the midline. A lot of people complain that they look boxy after they have had kids, and then all of a sudden you go at the after results and you're like, wow, these people are so curvy. That's not liposuction. That's corsetting the middle because your abdominal muscles just gave way. So when you repair the diastasis, it's functional and cosmetic in so many ways. Now we get to the cosmetic part. Do not just throw in the towel cosmetically because you have a severe functional issue. So in other words, like, okay, so I can't function without these binders and my belly looks terrible. I'll accept anything as long as it's better. That's terrible. You got to expect your abdomen to look amazing. You want to be in a bikini. Renee, how many times have you worn a bikini how many times did you wear a bikini with your diastasis the way it was when it got severe?
Oh, negative. I wouldn't even
never
want to approach that section.
Okay. How many times have you worn a bikini since?
Oh, probably at least once a week because we have a pool and I'm always in it now. Yeah.
Just think about that.
Yeah.
Now, if you have your diastasis repaired, but you have a hideous scar, a funky looking belly button, your scar is super high, you have a bunch of dog ears. I mean, I can name you 100 things. You won't be excited. Yeah, you'll be stoked that your muscle is better and you don't wear a girdle. But are you going to get naked and prance around in front of the mirror with you and your partner? No, you're not going to do that. So the second half of this is making sure your belly looks good. And so those require the same damn requirements that any other tummy tuck. Often patients who have severe diastasis have no normal belly button. It looks bizarre, funky, gone, flat, empty, right? So creating you a natural looking belly button out of an abnormal looking belly button requires skill. So many of them look terrible afterwards. And you're like, oh, I mean, it is what it is. No, it's not what it is.
Well, it becomes that you're embarrassed because of your DR because that looks hideous. And then if the aesthetics, obviously you're going in for function first to bring you in, but yeah, the aesthetics is just as equally important. Then you're embarrassed because you've got weird scars that, like the belly button looks awkward or the incision or whatever. So it's like you're trading one for the other. And really,
when you went online, what did you look for? How did you, what were in the photos, let me rephrase that. What did you usually see?
What I usually saw was a higher scar. It wasn't
high riding scar. Uh-huh.
Yeah, high riding scar. And I would see almost like a scar around the belly button. It kind of looked like, it was like a circle around the belly button as a scar.
It looks like a sticker or a quarter.
Exactly. Yeah. And the shape was a little bit, it looked fake. Like it didn't look natural at all. And also just like the quality of the scar. The things that I personally was looking for is I wanted something low and thin and just easy to hide. And even if it were to show that it wasn't like this, thicker, crooked, line that's coming out of it.
So what you wanted was everybody wants. You want a low scar that's thin, that's concealable with an attractive belly button and no dog ears and contour irregularities.
Exactly.
So the key is the same keys that I've had on many other tummy tuck conversations. When people say that the scar is low, they put the scar low and then what happens is that scar rises up and it's like 2 millimeters. It's like 2 inches from your belly button. Nobody wears their underwear near their belly button unless you're hiding something. It's a pooch, a poofa, whatever all the things are, or a high riding scar. So that's a kiss of death cosmetically. So once your scar is high, don't ever go looking for a revision. You can't ever bring that scar down. Your scar should be in your groin, where you would wear a sexy pair of underwear that are thong based. Your belly button should be small and cute and retracted. You should never have a dog ear. And your pubic area needs to be defatted so that it's smooth and contours with your abdomen. So those are all the things that you want to look for. Now, the last part of this conversation in terms of what you're looking for is what? Mesh. So I have never, and I've repaired some insanely bizarre looking severe diastasis. I've never used mesh. There is nothing missing. Therefore, there should be nothing added. And yes, it's skillful and the tissue's thin and you could perforate the bowel and you got to make sure you know what you're doing, but you should never add mesh, in my opinion. And so you just have to make sure that you do it meshless and that you don't just give in to the lowest denominator, which is this is the only thing people are offering. There are other surgeons. They may not be in your city, they may not be in your state, but you certainly can get what I think you need in order to have a good outcome. So the purpose of this episode was to tell you that if you have severe diastasis, good news is that, as Renee has described, if you have diligence and you have persistency, you can get it fixed. If you go look at number 1 in our gallery, it's going to be Renee. And she looks unbelievable. And you can be that way, but you cannot just throw in the towel, and you've got to do your homework and you have to have persistency. She does not want to see 11 surgeons, but she did because the first 11
were
shitty. And so what you can ask for, expect are the things we talked about and just follow the guidelines. And I assure you there are plenty of very skilled surgeons in this country. You just need to find it through their work.
Right. Yeah, don't give up.
Don't give up. That's the key.
Priorities.
At any rate, we're happy that you guys are tuning in. Renee, as always, you're just such an amazing advocate for diastasis and keeping, it's called paying it forward. You suffered for many years. And now, instead of just being like, woo-hoo, look at me, I look good, the hell with you, you've gone full circle, and now you're helping other women who are struggling with the same problem, and you're going to actually help them get to hopefully where you are, which is feeling sexy and confident and functional and running and skating and all the things that you deserve to do when you're a young, attractive mom. Okay?
Right.
Awesome.
For having me.
Yeah, of course. Love having you.
Really. Appreciate it.
Thanks again for everybody tuning into another episode of Plastic Surgery Uncensored. We have one more episode coming, which is 4 of 4. You better tune in because you don't want to miss out on that. That's going to be on how to pay for this whole process. All right, guys. See you next time.